Welcome back. This is Newsline. A new report has exposed the extent of the cancer burden in the country, with data indicating that there were 42,000 new cases recorded last year compared to the same number in 2020. That is 42,000 cases in 2020 and 27,000 deaths. The NHIF is now spending 3.8 billion shillings annually on cancer treatment alone. The report was released as the government rolled out plans for the first ever National Cancer Summit, which is scheduled to be held in February next year. Willie Lusiga reports.
Stakeholders are concerned with the sharp rise of new cancer-related cases. In 2021, 47,000 new cancer cases were recorded compared to 42,000 cases recorded in 2020, while 27,000 cancer deaths were recorded in 2020.
Cancer remains a major public health concern in our country. It's the third leading cause of death in Kenya. In 2020, the country reported for 2,000 new cancer cases and 27,000 cancer-related deaths.
The top 5 cancers in the country are those of the breast, cervix, prostate, esophageal, and non-Hodgkin lymphoma, with Mombasa and Nairobi leading with the highest cases of breast cancer.
The top 5 cancers are those of breast, cervix, prostate, esophagus, and non-Hodgkin's lymphoma. These 5 cancers account for nearly 48% of the cancer burden in the country.
The 5 types of cancers account for nearly half of the cancer burden in the country. 2 persons out of 3 diagnosed with cancer succumb to the disease, since approximately 70% of the cases are diagnosed in advanced stages where cure is almost impossible. Regretting that 9 women die every day due to cervical cancer, while 9 in every 10 persons with esophageal cancer will succumb to the disease.
Notably, 9 in every 10 persons with esophageal cancer will succumb to the disease. Currently, the majority of persons diagnosed with cancer will succumb to the disease since approximately 70% of the cases are diagnosed at advanced stages when cure is almost impossible.
76 people dying of cancer every day, 76. That means that we are losing many lives every day. But behind each of those lives is a family, is a business, is a community, is a country's socio and economic development. So for us, one of the biggest things that concerns us is 2 out of every patient who are diagnosed die in the year of diagnosis. This is because majority of them are diagnosed at a late stage.
The National Hospital Insurance Fund, NHIF, spent a total of Kenyan shillings 3.8 billion that went to cancer treatment in 2021 alone, accounting for 6% of the total expenditure on claims last year, spending an average of 1.6 million shillings on a single cancer patient. 40% of the amount went to chemotherapy, 23% on surgeries, while the remaining amount being distributed to other cancer treatment processes such as radiotherapy and imaging.
All those people, 47,000 unique individuals last year that NHIF helped, and we're not talking about the enhanced schemes because those have been paid for by their employer, ordinarily would not have been able to afford that. And I'll tell you for a fact, it doesn't matter which part of the world, no one can carry the cost of healthcare on their own, and especially with issues like cancer. Even with those benefits, when you look on average how much we pay for a cancer patient, it's close to about 1.5, 1.6 million when you look at those packages. That is even a benefit that most of the private insurance would not even be able to provide, because everything is capped to small limits and sub-limits.
The National Cancer Summit 2023 will provide an appropriate platform for stakeholders from across all sectors to, among other discussions, deliberate on the recommendations arising from the Cancer Task Force report, review the progress made over the last 10 years in addressing the cancer burden, identify areas of learning from successful strategies, and together formulate solutions for collective action.
When we are talking about this cancer debate, really, our discussion starts there, that in the first place, we ensure that we limit the number of people who acquire cancer, who get cancer. And this really is embodied at the programs that counties are doing at the community level.
The National Cancer Summit, as the word says, summit,
is going to be a forum for all of us to get together, to bring our views, to bring our voices, to bring our experiences, our knowledge and skills, harness them together over 2 days, and come back and say, this is really what the Kenya people want for better lives for cancer. This is the blueprint.
Willis KTN News, Nairobi.
Now, Dr. Alfred Karago is the CEO of the National Cancer Institute, the ones that have released